I'm Amy Kloshabor. I was part of the first class of the combo Medicine-Anesthesia Residency. After completing that in 5 years, I did a one-year critical care fellowship, and I graduated this past July, and I started attending at Stanford in the ICU and in the ORs this past September.
My name is Jay. I'm one of the current critical care medicine and cardiac anesthesia fellows at Stanford. I originally grew up partly in New Delhi, India, and then 12 years in Dubai. I first came to Stanford as a med student about 11 years ago, and I liked it here so much that I did the combined internal medicine anesthesiology residency here, and now I'm finishing the second of my 2 fellowships.
Hi, my name is Jason. I'm actually a Bay Area local. I did my undergrad here, and then I went to New York actually for med school. I did the combined program, and then last year I did a cardiac anesthesia fellowship, and this year I'm doing my critical care fellowship.
There was one incredible anesthesiologist that was working in the SICU who had also done medicine training, and she said how much her medicine background had really helped her as an ICU attending. And she and another couple of my mentors pulled me aside and said they'd read about this new program that was starting at Stanford that was a combination of internal medicine and anesthesiology, and that it would really prepare me for my ultimate career goal of being an ICU physician.
I like both the fields equally. I couldn't imagine giving up either of them, so I decided to do the combined training to see where my career interests would evolve.
In a previous life, I was a critical care nurse, and I just knew that this was sort of the realm for me. When they had that opportunity, I instantly said that that's where I wanted to be. I knew that both the internal medicine background would help me in my critical care life, and I knew that I also wanted to be in the OR. So it was sort of the perfect blend of the two.
Each of the programs, both anesthesia and internal medicine, were really accepting and flexible and really wanted to tailor our residency to what exactly we wanted to make it. So we were able to get our medicine rotations that we thought would be more applicable to our ICU. We got to do things like pulmonary hypertension and pulmonary clinic, inpatient rheumatology and other things that were actually quite relevant and able to really tailor that appropriately.
My academic and research interests are very much in the field of cardiothoracic critical care medicine. I like to work on outcomes of patients who are supported on artificial heart-lung machines in the ICU, which we call ECMO. There's a lot that goes in to make sure they do better post-operatively, and that's another field of my interest, which merges both the internal medicine and anesthesiology training.
I'm going to join a group at a large HMO here, and I'll be doing half cardiac anesthesia and half working in the CV ICU or the cardiothoracic ICU. And there's a lot of Stanford alumni there, which will be great because I'll be able to continue being mentored in the beginning of my attending years, which I think is kind of critical to any job you take.
Something I'm really interested in is actually liver transplant anesthesia. It has a really nice crossover between the OR component of it and actually the preoperative evaluation and post-operatively dealing with liver transplant patients. We get to see a lot of the pre-op livers in the MICU, and it's really nice kind of seeing them ultimately get their liver and finally have their problem fixed.
The internal medicine and anesthesia programs are very large programs. So you get a lot of other people, other co-residents, but you still yet get that small feeling because you're with your small cohort. We sort of feed off each other, and every time we see each other, it's kind of like coming home again.
When I came here initially, I was single, and now I have 2 kids, and I've been able to share that journey of becoming a young parent while being a trainee with some of the faculty, as well as develop my academic and scholarly interests over time. I think that's one of the biggest strengths of coming to Stanford, are the people over here.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.